Be glad to take your questions.
Governor, on long-term care facilities, and this is also for Dr. Oliver, I know we talked about getting new information about exactly the number of outbreaks that are happening right now. Do we have an update on that? And then kind of bigger picture, Canterbury right now reporting 32 deaths. That's a large number. You know, can you give us kind of a state of how y'all are getting a handle on this issue with long-term care facilities?
Yeah, thank you, Henry.
Thank you. So as I understand your question, you're asking about Canterbury here in Henrico and the large number of deaths that have occurred there. Those deaths aren't reflected yet on the VDH site, so there'll be a discrepancy there. There have been news reports that the deaths now number 32. The Canterbury site, like other long-term care facilities, has a population that is at very high risk of mortality from COVID-19, and that certainly proved to be the case there. The local health department in Henrico and the management of Canterbury have done their best to isolate the cases as they can and provide distancing, quarantining those cases and so on to try to keep down the spread. I think part of your question is what is that sort of meant for us in terms of other long-term care facilities. And our local health departments are working very closely with long-term care facilities in their districts to really stay on top of what's happening there and increasing our surveillance of that. We've broadened our test criteria so that we could test more people in the nursing homes and other long-term care facilities. As more tests become available, we will increase our testing in those areas because it's in those sort of congregate settings that we think the risk is highest for the sort of thing we're seeing at Canterbury.
Do you guys have specific numbers yet?
I don't have specific numbers I can report to you now, but we should be able to gather that for you.
Yes, the first question will be from Roger Watson with the Farmville Herald.
Hello, thank you for taking our questions. Prince Edward County officials say they have a PPE shortage for first responders and some other county agencies. Is this something the state can help with, or are the counties on their own to get those supplies?
It's a good question, and the question is there are localities, first responders, et cetera, that don't have enough PPE, and the answer is yes, we can help. And as I mentioned yesterday, we have ordered a shipment, $27 million worth. We expect that to arrive in the next few days. But I would ask any locality, whether it be the firefighters, whether it be first responders, law enforcement, whatever, if you are getting toward the end of your PPE or don't have PPE, please let us know, and we will do everything that we can as we disperse this equipment across Virginia to take care of as best we can all of your needs.
On long-term care facilities and nursing homes. I know that several organizations such as Leading Age Virginia and VHCA are concerned about staff sharing between different facilities. Given that, is the state willing and able to provide them with a list of affected facilities specifically so they can alert members, if there are facilities that might share staff and help mitigate transmission?
Your question is, are there facilities where if we know of individuals that have tested positive, that can be made public? Is that
well, just can the state release that even to the facilities themselves so that they're aware?
Mm-hmm.
We actually do that. That was one of the things we did, for example, with Canterbury here in Henrico. We knew that staff were working in other facilities, and we let those facilities know specifically that they had staff working with them who might be vectors for having the COVID-19 appear in their facilities. And we did our due diligence in trying to contain that, and I think we did a good job. It hasn't spread to those other facilities.
In your latest clinician letter, you said that the guidance currently is that asymptomatic workers who may have been exposed can continue to work as long as they wear a face mask. Can you go into more of why that might be and why that guidance was issued?
So the question is, why would we have as part of our guidance to nursing home facilities, and for that matter to all healthcare workers, is that if they're asymptomatic, even if having been exposed to a COVID-19 patient, they could continue to work. Why would we do that? Healthcare workers are among the front lines in fighting this disease, and they are not of unlimited supply. And we want to keep them working as long as they can do so. In addition to monitoring their symptoms, however, some guidelines, if you look at the CDC, for example, they'll talk about things like checking for fevers and other things that can be checked objectively. Once symptomatic, then they would be quarantined.
Yes, the next question will be from Bill Atkinson with the Progress Index.
Very much. Governor, my question is to you. Will you consider issuing an executive order to relax the requirement that physicians' attendants must be supervised or consult with physicians so they can better help with the front lines, to relax this requirement in cases of emergency? I know that the American Academy of PAs has been pushing all of your colleagues across the country for orders like this, and I think so far 4 have responded. What would be your response to that?
The question is regarding PAs or physician assistants and their supervision by physicians. And this system has worked very well in Virginia. We obviously want to do everything that we can to work together as a team to make sure that we're adequately taking care of the patients. We want to make sure that our staff is available, that they're healthy, et cetera. I would just assume that as we move forward, whether it be in the hospital or nursing home or wherever, if there's a PA, there's a very good likelihood that there are going to be physicians as well. And so I don't anticipate, the question was whether I will be writing or signing an executive order to change that relationship between the PAs and the physicians, and at this time I don't have any intention of doing that. I think the system, the way it's designed, the way is working very well right now.
Governor, can you talk about what types of patients are being prioritized for testing at the state labs, and what percentage are being tested by private labs?
Okay, Dr. Oliver?
Yes.
Thank you.
So the question is, what types of patients are being prioritized for testing? The criteria that we set for that is one that looks at people who have symptoms that are consistent with a corona-like illness, and also patients who have those symptoms and we don't have any other reason to explain it, like flu or some other illness that could explain those symptoms in a hospital setting or in a nursing home setting, and in any patient who's 65 or older.
And what percentage of the tests are being conducted by private labs?
That I don't know. Do you have that information, Dr. Tony?
I don't know.
We know how many tests we have, but we don't actually know how many tests the private labs actually have.
The next question will be from Bruce Potter with Inside Nova.
Thank you. Governor, nearly 45% of the state's positive cases are up here in Northern Virginia, and the Washington area has been mentioned among cities that might be hit the hardest over the next few weeks. Are there any specific hot spots for the virus that you and your team have identified in Northern Virginia? And what are you hearing from the hospitals up here in this region about their ability to handle the projected surge of patients?
The question is Northern Virginia and certainly the density of our population, and what am I hearing from our hospitals and what are they doing to prepare for the surge? First of all, I will reiterate that the mayor of Washington, D.C., Mayor Bowser, the governor of Maryland, and I have been working very closely. We have tried to be consistent in our guidelines, especially the stay-at-home, social distancing, et cetera. We realize that the greater Washington area is at risk to be a hot spot. As far as any particular areas in Northern Virginia, I mean, that data is available. We've obviously had cases in Fairfax, Arlington, Alexandria, and we would be glad to share that with you. But it's part of the question, what are the hospitals doing? We are preparing for all scenarios, and I think we've outlined a lot of those plans. But I want to commend the folks for the greater Washington area and in our case in Northern Virginia for really doing a good job in following the guidelines. I've had reports that have come back from various areas in Northern Virginia, and they're taking this seriously. And the key here is that if we can continue to follow those guidelines, we will do what we need to do in flattening this curve, and we'll put a lot less of a burden on our hospitals. But I will tell you, in just talking to the CEOs from our hospitals yesterday, they're ready. There's no question they're being taxed. They're working very hard. Their healthcare workers are coming to work every day. They're worried about PPE. They're worried about the testing, all of the things that we've been talking about. But they are prepared to take care of Virginians in the event that this surge occurs, and I'm proud of all the work they're doing.
So Maryland is sending these so-called strike teams to help nursing homes with care, with supplies. Given the crisis at Canterbury, is that something you all are considering as well?
The question is about strike teams in Maryland, and I would say that if you go back and look at what we've done, we're essentially doing the same things. We have been very aggressive on making sure that we isolate individuals at the nursing homes, and I think the point that needs to be made, a couple points that I'll make. First of all, we're so sorry for those that have lost loved ones, not just in the nursing homes, but all of Virginians. We regret that, and we're doing everything that we can to keep Virginians safe. But the challenges that we're having in our nursing homes, I think, speaks to a couple things. One is how contagious this virus is when it gets in a confined space like that. And it also speaks to the challenges that all of us as governors have had, and that is the lack of PPE, which we are continuously working on, and also the difficulty with the testing. And that gets better every day. But if you can only imagine when there's an individual at a nursing home or anywhere that we think may be positive, and this lab test is sent to one of our private labs, for example, and the turnaround time is 7 to 9 days, that it really ties our hands. And so there are a lot of challenges, but I will tell you that, and I commend the Virginia Department of Health, and I also commend our nursing homes. It's a difficult situation, but they're doing everything that they can to keep these individuals safe.
Michelle Hankerson with WHRO.
Hi, we're hearing from a lot of self-employed folks who have had trouble applying for unemployment benefits. I know the VEC has amended their process for people who are self-employed, but I was wondering if those applications will be expedited. We've heard from people who have applied multiple times. They're reaching a really critical point financially. So I was just wondering if there will be a special expedited process for them, and if not, what they should do.
Okay, I'm going to ask our Chief of Staff to address that. Clark, thanks.
Thanks. Well, the question was about individuals who are unemployed and seeking assistance from the state. I would point out that nationally and at the state level, we're seeing record numbers of unemployment. So that is stressing the system federally and at the state level. And the governor on Monday announced that we are doing an overhaul of our various websites and databases to accommodate the incoming calls and requests. Our 211 call center, we are using monies from the federal government, the Relief Act, to add individuals to answer the phone and get back to folks. And I will also say, and more in the coming days, but we are very mindful of individuals who have lost their jobs and the small businesses that are affected. And we are looking at different options over the next several months to make sure we can get those folks the aid that they need and the working capital that businesses need to hire back and hire back quickly. So thank you.
Yeah, I'm wondering if the state continues to actively investigate the Canterbury facility, if you have any more insights about what could have gone wrong there that, hopefully we can avoid in other facilities? And then also on this issue of PPE, I know that there's been such a complaint among federal lawmakers that FEMA has not prioritized Virginia. So I know there's a couple of questions there, but I think they're all very important for this issue.
Yeah, the first question is are there investigations on looking into Canterbury and what could have been done? I think I touched on the challenges that we've had, and they have been aggressive from the start. And I think the day will come in the future when people can go back and assess the various things that were done or could have been done. So we're right now trying to make sure that not only with Canterbury, we're doing everything that we can to protect those individuals, but to prevent this from happening in other nursing homes. But I will tell you that it's a real challenge for us, but we're doing everything that we can to keep them safe. As far as the PPE, it's a great question about has FEMA been slow to direct some of that equipment to Virginia? And I'll go back to what I said earlier. From the start of this pandemic, there has been limited direction from the federal level, whether it be from PPE, testing, ventilators, et cetera. And so every governor has been on their own. And we, as I said earlier, we're literally competing for that same supply. We're competing with other countries, we're competing with other states, we're competing with healthcare systems. And I think that Virginia, actually, I'm proud of what we've done to have the amount of PPE that we have. As far as what they have in their stockpile in Washington, we have requested a certain amount of PPE. Ballpark, I'd say we've gotten about a 10% of what we have requested. And in all fairness to FEMA, there are hot spots. I'm doing everything I can to protect Virginia, but there are hot spots such as New York, Detroit, New Orleans. You all know all the areas that are really being hit hard. So they're really directing a lot of their supplies to those hot spots. And we're watching very closely. We're looking at the data every day, and there are a lot of people that are concerned that the greater Washington area may be one of those up and coming hotspots. And certainly if that happens, and I think FEMA will redirect some of their equipment to that area.
Thanks, Governor. I'm Bree Season from CBS 6. I've been reaching out to your office for the past month repeatedly, trying to get a feel on some of these 427 outstanding pieces of legislation,
yes,
several of which have never been more pressing to our viewers. So I'm wondering a couple things, if you anticipate doing anything, signing perhaps the Torian Favola bill on ending balanced medical billing, Sickles' efforts on certificate of public need reform, and perhaps most pressingly to the financial viability of emergency rooms. There's a budget amendment in HB 30 that would downcode a lot of potentially Medicaid visits to ERs to $14 for these physicians in a day when they're fighting really hard to do as much as they can. Are those things that you're still considering at this point, and what are your thoughts on those three, especially because of the Saturday deadline?
Yes, the question is there are a number of pieces of legislation that we're continuing to study and that I will act on by Saturday. I would just say at this stage, I've acted and signed over 800 of those pieces of legislation, and I would just say to be patient. We're working through those. By Saturday night at midnight, they will have all been acted on, whether they have amendments, whether they're passed or signed without any changes, or whether they're vetoed, and all of that will be public on Monday morning.
A budget amendment specifically might save the state $14 million in Medicaid payments, which is, saving the state budget at this point is something you've emphasized is important, but it could affect the access to public health for a lot of ERs.
Yes, I'm going to make it a little bit clearer, maybe than I did the last time. All of these pieces of legislation are important. We're working through those. Yes, I'm going to do everything that I can to protect our budget, but all of that will be released as of Saturday night at midnight. So thank you for your question.
Yeah, the next question is from Tracy Agnew with the Suffolk News Herald. Tracy? Okay.
Yes, thank you so much for taking our calls. My question is about testing resources available to medical examiners in the state. Reports from other states are that their coroners aren't able to test the dead who had symptoms of COVID-19 but weren't tested while they were living. So have medical examiners in Virginia been given the resources necessary to do so that their contacts who are still living can be notified?
The question is whether we had the ability to. Dwayne, is Dwayne in here? When you get a chance, this microphone, I think, is out. But the question is, are we testing, or do we have the ability to test those deceased so that their family members can be notified? I don't.
To test
those that are deceased, whether they had COVID-19.
Okay, so the medical examiner is in the Department of Health office of the chief medical examiner. Cases that wind up at the medical examiner are cases that are not known to have had a natural death, so suicides, homicides, other things that are being investigated wind up there. And in that situation, I think that we could certainly consider the possibility of testing. That would be another situation where with increased testing capacity, we could add that as a criteria. At this point, we're not doing that, however.
I just wanted to add to what the Commissioner of Health has said, is that there are indeed patients that were tested at the time they were critically ill, and the test results were not back. And those are made available to loved ones when those results come back. So those results are made aware, the families are made very much aware of that test result.
Also, Dr. Tony corrected me. I misspoke. It turns out that we do, in fact, do the testing on cases that appear at the medical examiners.
Two separate things. One, we've gotten a lot of complaints from people who are working at either the essential or non-essential businesses that their coworkers have contracted COVID-19, but then they haven't been informed by their employers. They found it in other ways. What are the requirements for these businesses to inform all employees that one of their coworkers may have gotten sick? And then as well, any update to the UVA surge data report that you were expecting?
I'm going to answer your second question first. Any updates on the surge data coming from UVA? We're continuing to work with UVA, University of Virginia, and they're continuing to collect data that is specific to Virginia. And I don't want to make any guarantees, but I think in the next day or so we'll have a lot more information on that particular model. They're getting very close to where they have the data to be able to make predictions. You want to address the other question, Clark? Thank you.
The first question was about individuals that are working in businesses and have concerns that employees might have gotten coronavirus and have not been informed by their employers, and that is an issue nationally. We have DOLE, the Department of Labor and Industry here in the Commonwealth, and that's the first place for folks to call or email or go online and make such a complaint. And then DOLE works with the federal government to address those. A call from our commissioner of the Department of Labor will get a business owner's attention. But I would say a few days ago, we received word that a couple individuals had contracted coronavirus from a Virginia business, and we heard about that through the media. And I would say, one, thank you for the job that you're doing. It's important, and you're looking into important issues. And so we're grateful for that. The first thing that I did when I heard about that was get in touch with that business and cite our displeasure that we would hear from the media about these cases. It's incumbent on both the government and private sector to be transparent and to be proactive if we're going to get on top of this and we're going to be able to get out of this and quote unquote get back to normal. So it's a two-way street. Obviously, there's a lot of folks who are working who are stressed, and if they feel that they're in a workplace where their employers are not being receptive to the social distancing, our Department of Labor and Industry is the first place that they should go.
So they are required, though, if one employee gets sick, are they required to inform everyone else that there has been?
I don't think they're required to, but I think it would be common sense if you're in a workplace. We have protocols that we would share with certainly we abide by the state government, that if an individual contracts coronavirus in terms of cleaning, distancing, whether or not we let the public into certain buildings. And so common sense would tell you if you're in an office and someone has contracted that, I think management needs to be proactive and let their employees know.
Thank you.
The question is from David McGee with the Bristol Herald-Courier.
Yes, thank you, Governor. A two-part question regarding the election. I saw in material from your office that you're suggesting that the absentee ballots already cast be discarded, so I was wondering why. And second, given the proximity of the election, might you call the General Assembly back in a special session to act on your request?
I'm going to let our Secretary of Administration, Kiana Connor, address those two questions. Thank you. Thanks, Kiana.
So the question is about absentee ballots that have already been cast. Virginians should know that every voter will have an opportunity in November to vote for those offices that were to be on the ballot in May, in addition to all other ballot offices in November. So in November, there will be one ballot, and voters will have an opportunity to vote for all of those offices then. So absentee ballots that have been cast to date will be discarded.
Other questions about a special session, I guess I can answer that one. The second part of that question was, would I call a special session? And the legislators are coming back on April the 22nd, and we will ask them to take up the issue of moving the May elections to November. So that will be part of their job when they return on the 22nd.
Governor, as you know, we broadcast in all of Hampton Roads, of course, in Lynchburg, Roanoke, and we've been getting some concern calls concerning the African-American community, wondering if your administration was prepared to maybe produce special messaging, PSAs for the African-American community, also opening up some of these community centers that are closer to people of color. These centers are closed, maybe opening them for testing and information, and lastly, making sure that federal funds are used to help to get these messages out to the African-American community.
The question, and I appreciate your question, was how can we better communicate with the African-American community, and for that matter, all communities. And we do have an Office of Diversity, Equity, and Inclusion, Dr. Janice Underwood, and I will pass that recommendation on to her. We, as you may know, we have done a number of PSAs, public service announcements, but I think to your point, it would be a good idea to let people know all the things that we're doing for the different communities. So I'll take that certainly into consideration as we move forward. Yes, and Dr. Oliver would like to comment as well.
I mentioned that in the unified command we stood up as a whole of government response to the COVID-19 pandemic. That unified command has a health equity work group that's part of the overarching general command. Okay, so it's at the highest level, and as a cross-cutting function, it looks at all aspects of our work, and one of those aspects is our communication campaign. We have what we call a joint information center that is putting out PSAs, videos, other communication things, and we're sitting down now mapping out an entire campaign that will be directed to the African-American community, looking at what to do about the Latino community and other vulnerable populations, making sure that they get messages around this that are appropriate and easily understood and help get the message across. So all the points you made, I think, are very important, and we're definitely working on it.
If I can follow up real quick. Also, there are members of the self-employment community who kind of struggle with getting their applications processed. They feel as though the system is not ready. One of them said that they were told that we are flying by the seat of our pants. We don't know how to really structure all of these claims, if you will. Did your secretary speak to that earlier? The self-employment community, the self-employed community.
And we can make sure to, again, put out the websites and the phone numbers. We do have individuals here to help with those issues, and I know it can be very cumbersome for these people to navigate the system. And I don't have the website or the phone numbers, but I want to make sure to get them to you. But encourage folks that do need assistance that we are here to help with that. Any other questions?
Just to clarify for the data, the racial and ethnic data, are you going to be able to get the data for those tests that have already been completed, the 53% that's already on the board? And again, these are just, I guess, suggestions to the private labs, not a direct order?
Well, that data is not, if the clinician, if I was ordering a test on a patient I was seeing in the office or at a clinic or at the hospital, if it was not included in that original data, I don't know of a clear way to go back in time to get that. I think the best that we can do is to do the things that the Commissioner of Health indicated. One is to get all of the provider community to supply that information on the front end, and Dr. Oliver indicated how when there are complications, God forbid, like folks passing away from COVID-19, that we capture that data as well. So I think it will be difficult, and I'm not sure of a mechanism to go backward in time.
Just in closing, a couple points that I wanted to make. First of all, you see and you've heard from a number of individuals that get up in the morning. Half of them are staying up at night as well, for that matter. But they're very talented. They're very hardworking. And just on behalf of Virginia, I think you can all be proud and should know that these individuals are working very hard for you. The other thing I wanted to say is I really do appreciate your all's questions. I don't have answers for everything, but when we hear these questions, it makes us think of what more we need to do. And whether it's input from our legislators or our local officials or just the public in general, we appreciate your input. We appreciate knowing what you're dealing with out there as we all work through this together. So please continue to give us your input. That's why we do what we do. We want to help you. And as I've said every day, my main goal right now is to make sure that we get this health crisis behind us, that we keep all of you as Virginians safe. And just as soon as we can get this crisis behind us, the healthcare crisis, our economy will bounce back, and all of us hopefully can get back to our lives as we knew them before COVID-19. So again, thanks to the press. You all are doing a wonderful job covering this. I thank you on behalf of the Commonwealth, and to all of you out there that listen to us when we do these press conferences. I thank you, and I look forward to being with you again on Friday. Thank you.